Hello there, and welcome to a nice, quick, but super effective sequence. If you're feeling especially tight in your hips, low back, maybe even a little nervy up and down the leg, and a little bit nervy around your SI joint. You'll need some space on the ground. You might need a strap. Anything else? Maybe some blocks for some support, but let's get into it. So, what you're doing here today, so that you know, because you might be very flexible and this may not feel effective, you might be very tight and it might feel like a stretch, but really the intention behind this sequence is what we call flossing or nerve flossing. So, when a nerve is pinched and gets stretched, it just gets mad. It gets mad, it gets irritated, it gets inflamed and the alignment can be really uncomfortable. So what we are doing in this sequence is both on the ground, hands and knees, and seated, is we're finding ways to floss the nerve, meaning we're moving the nerve in and around its casing, not around its casing, but in and through its casing to lower the inflammation, to get it less angry, and to get some circulation and some stuff going on. So go ahead and start on your back. If you happen to have a Pilates ball, go ahead and grab it. You can also use a yoga block for this. Just put your prop of choice between your thighs. Take a moment to lay on the ground. Let your pelvis be heavy. So let go a little bit. Drop that low back, sacrum rather, and your skull. Let your skull be heavy. Now, throughout the sequence, we are going to be moving our head, and at no time am I asking you to lift your head up off the ground. I want you to stay connected and calm into gravity. So just to get started, let's, as ever, start with our breath, where everything begins and ends. Take a breath in through your nose. You might feel your ribs expand a little bit, maybe your lower belly, and exhale. One more time, take a breath in, feel the expansion. And on your exhale, feel everything finding its way back to midline, to center. Now I want you to take your awareness and put it on the prop between your thighs and give that prop a little squeeze. And I want you to squeeze it 10 times. So squeeze, 2, 3, 4, 5, 6, 7, 8. Good. Now keep the prop there, but don't over squeeze. We're sending a message that we need our inner thighs, our adductors to be on. They're going to support us here. And they're like the beginning or the preliminary to your core, your pelvic floor and up. So we want those inner thighs to be stoked. So from here, we're going to start with a pelvic tilt or otherwise known as a pelvic rock. So you're going to push your lower back into the ground. And then you're going to very gently and sweetly lift your lower back off the ground and point your pubic bone away from your belly button. So again, rock it back or posterior, and then rock it forward or anterior. Now you're going to add your breath. Take a breath in when it's tilted forward. Exhale, press your lower back to the floor. Do that 4 more times. Inhale, rock forward. Exhale, rock it back. I'm going slow for a reason. If you find that you're not going as slow as I am, that's okay. And soon we're going to add our head. You might even already start to feel that your head, as you move your pelvis like this, rocking forward and back, is kind of mimicking your pelvis. And that's what we're going to continue. So go ahead and inhale, drop your chin to your chest or towards your chest. Remember, don't lift it up. Arch your lower back, inhale. Now curl that pubic bone up, press your low back to the floor and lift your chin up. Sorry, my hairdo is not good. And then lift your chin up as if you could see what's behind you. So here we go. This is the start of our floss. So rock your pelvis forward, chin comes down, eyes down. Rock your pelvis back, chin lifts, eyes back. And just see if you can do all three things: pelvic rock, head, and breath. Inhale, chin down, pelvis forward. Exhale, chin up, pelvis back, breath out. One more time. Good. In the interest of time, that's going to be that for now. But if you like that, pause and keep doing it. Go ahead and release the ball. Pick a side. Let's start with our left. You're going to interlace your hands behind your thigh. If you feel comfortable, you can extend this leg long. But if you're tight here or your hips are tight, you're going to pop up. And it's better just to keep your knee bent and your foot flat on the floor. It's better for your pelvis. So now we're going to floss down the back of the leg. You're going to hold the back of your thigh perpendicular to the floor. Notice I'm not pulling my thigh into my chest. I'm keeping it perpendicular. And this is where a strap can be helpful, or a rope, or pretty much anything you've got. This is what I have within reach, so I'm going to use it. And we're going to bend our knee, and then from the heel, we're going to extend almost like we're going into a stretch, but then we're going to take it back. Extend, take it back. Extend. Good. Again. Now just pause with your leg as straight as you can get it and circle your ankle 3 times to the left, 3 times to the right. We really need to take care of our ankles. Please take care of your ankles. Now you're going to point your foot and flex your foot. Now this looks like a floss, so we're going to add our head. As your toes come back, your chin lifts. As your toes point, your chin drops. Good. That's that for that side. Let's do it on the other. Go ahead and interlace your hands or get your strap behind your left thigh. Straighten your right leg if you want or not. Extend the leg, release. Make sure that thigh bone's perpendicular to the floor. This is not for your hamstring stretching. We are flossing a nerve. Good. Now keep that there. Circle the ankle 3 times to the left, 3 times to the right. Point your foot, flex your foot. Use your flossing. Drop your chin, lift your chin, drop, and lift. Very good. Now just take a moment before we transition. Shake your thighs out and make sure you're not over gripping your glutes. It's very common for people to grip their glutes and tuck under, and that is compressing everything back there. So try to avoid that if you can. All right, this one's one of my favorites. You're going to lay on your left side, or whatever side you want to. You're going to do both sides, but know that when you're flossing, you're really doing it for the affected side. So you're laying on your side. I have my hips stacked. My bottom leg is just relaxed. It's chilling. It's bent enough to be out of the way. Also move any props out of your way. You'll see why in a second. I'm going to take this leg, keeping it on the floor, and I'm going to glide it along the floor. Now, the moment I feel anything, not the biggest stretch in the world, I can bring my leg up here, not the biggest stretch in the world. The moment I just feel something, that's going to be a signal to pause. Now, if you have sciatica, you know exactly what I'm talking about. Now, as you lift your leg this way, you're going to try to look over this bottom shoulder, the shoulder that's on the floor. I want you to try to look past it. Now, as you swing this leg or move this leg, glide this leg behind your bottom leg, you're going to drop your chin down and try to look at your belly button. So this is really nice. This is a sideline floss. What's nice about this, you might ask? Well, gravity for one thing. You don't have to work too hard, do too much, and it's super, super effective. So that's that side. I'm going to come do the other side, and then we'll move on. Obviously, do these, you don't want to do them 75,000 times, but 20 is probably fine. 30 is probably fine. You could take a break and come back, lay down, hips stacked, head resting. Once you feel that stretch or any kind of sensation, that's that. You're going to look over your bottom shoulder. Then you're going to sway back and look down. And that's that. So again, if you like that, pause and do it. All right. Press yourself up using your hands. Come to all fours. Now, you're probably familiar with what is known in the yoga world as cat and cow, or flexion and extension. And we're going to do it, but we're going to do it in the opposite way that you're used to doing it so that we can, say it with me, floss. So, traditional cat pose is a rounded spine, head is down, tail is tucked, right? Traditional cow pose is an extension of the spine, widening your sitting bones, extending your sternum and maybe a little bit of your chin. We're not collapsing though. Notice I'm pushing up and out of my shoulders. Now we're going to come into cat spine, but I want you to, it's going to look and feel really weird. Lift your chin, right? Now, as you cow your spine, you're going to drop your chin. So it's the opposite of what you think. Curl your tailbone, lift your chin. This is the floss. Drop your chin, extend. One more time. And release. Good. Moving on from here, we're going to do one leg at a time, and I'm going to show you from the side. Stretch your one leg out stretch your right leg out to the side. Make sure, like more or less, that the arch of your foot is in line with your knee. Let's not be hyper vigilant or overly precise about alignment. We want to have a sense of it, but we don't need to be rigid. Now, from here, you're going to rotate this leg out and turn your kneecap and your toes to the sky and tuck your tail underneath you as you round your spine. Then you're going to extend your seat back behind you, kind of stick your butt out a little bit and turn your leg back in again, turning your toes to face forward. It looks like this. Try to add your breath at every turn. This and the sideline flossing was by far the most effective for me. Right? So I'm going to show you the supporting leg because it's important that that is also having some rotation. So this is rounded and this is extended. Try to get that thigh back. Good. One more time. And one more time. Other side, just so you, my hair is funny. Just so you can see it. Go ahead and switch legs. And if your shoulders are tight or tired, you can always put blocks underneath your hands so you feel more elevated off the ground. Let's just do two together, just so you can get the rhythm. Line it up. Here we go. Turn your leg out, right? But you're scooping your seat under. If you have sciatica, this is where it is. So you're kind of flossing that in the casing as you drop that chin and spine. Extend and stick the seat back. Don't overdo it. Just reach and extend through your spine. One more time. Bravo. Excellent. From here, you will have a seat. Choose your leg, extend it out to the side. Now, what befalls on a lot of people when they come to sit on the ground, first of all, sitting on the floor is hard. And if you have any sort of tight hamstrings or tight hips or anything going on, you're likely here. You're probably just slightly tucked under and collapsed. The work is in getting your thighs back. You have to tilt that pelvis forward. So those pelvic rocks we did in the beginning of class, they can assist here a little bit. They're the pathway you want to take to getting to being able to sit up straight in your spine. But no shame if you can't, okay? Just assist yourself. Grab a pillow, preferably a blanket, and go ahead and sit up on it so that, and then scoot forward a little bit. You see from the side, that lifts me up and I can kind of rock that pelvis forward now. I have a little bit more of an assist. So go ahead and give yourself an assist. Take your leg, slide to the front of your pillow so that you have that flip of the pelvis. Now you're going to lift your chin and flex your foot. Point your foot and drop your chin. More flossing. Good. Do the other side. Good. Make sure you're doing it with your breath. Excellent. Bravo. Now for bonus points, let's do a little piriformis stretch and then we're done. You're going to come back to your hands and knees. You're going to bring your knees to touch. Okay? I want you to move your lower legs like they're glued together, like they're your tail. Now, when you send your feet over to the right side, you're going to take your right leg. So the direction that your feet are pointing in is that leg's going to extend back. Now, your left thigh bone is more or less directly underneath your pubic bone. That's going to give a nice pull on this outer hip. You can stay here if you want. This might be plenty for you. If you need a little more, you're just going to rock forward and back. This is less for sciatica and more for piriformis, or that outer hip muscle that gets very tight for a lot of us if we sit a long time. So there you go. If you want to go even further, you can lower to the elbows. And again, you can rock, and you can always add a floss. So tucking the spine, extending the chin, extending the spine and tucking the chin. Good. Bring your knees together, swivel to the other side. My toes are to my left leg goes back. I rock. All right, my friends, that is your flossing sequence. Whenever you can, as much as you can, try to avoid crossing one leg over the other. Walk around, stand up tall, lift up out of your pelvis. Try not to sink and dump your weight into your lower back. And I hope this helps. Do it often and much. Safe home. Talk to you soon. Oh, and if you like this video, hit subscribe. Thanks so much.